coming to USG, latest recommendations state that by the gynecological age of more than 8 or chronological age of 80 years, the maximum ovarian volume is reached. That means it will take 8 years to reach the maximum volume, and you call it as a large ovary. Fine, wait, are you sure? How wise it is? And in a developing or maturing HPO axis, there can be many, and I must say, one of the speakers did cover this, that where there can be multicystic ovaries, which you can misdiagnose as polycystic ovaries. So how wise it is then to do an USG for a diagnosis of this at this age for PCOS?
It's not advisable.
Not advisable. Rajan, thank you for taking a very clear stand. With USG now not being recommended for the diagnosis of adolescent PCOS, how should we diagnose PCOS in adolescents who present with AUB? Please wait. And there are two pillars. They say clinical hyperandrogenism and laboratory hyperandrogenism. Now I want your expert comments and guidance on how will you call clinically hyperandrogenism? Any of my teachers, anyone, Purvi Ben, Raju Bhai, Deepali Ben, Dodakia Sahib, Divya Ben, anyone can please tell.
Sir, hirsutism will be there, and other symptoms of hoarseness of voice can be there, irregular periods can be there. So this is clinical signs of hyperandrogenism will be there.
Hirsutism, acne, and alopecia are the main signs for the clinical hyperandrogenism.
Thank you for completing the list.
But acne more than 10 in number.
Okay.
Yeah,
more than 10 in number. Okay.
10 in number. And Ferman-Galvez score also 4 to 6 or more.
Go for this FG score, modified FG score, and then we have to.
Excellent. Come to the lab diagnosis. Now, would you agree to this recommendation? Would you request for this calculated free testosterone or free androgen index or bioavailable, any one of the three? That is what they are telling. Would you like to do this? I will also be requesting you for your opinion on FSH-LH ratio. But please wait. Please tell me about these. Does any one of you do this for diagnosis of hyperandrogenism? Ami Ben or Raju Bhai says no.
Sir, if the clear cut she has symptoms of hyperandrogenism, what we have described, then no need.
No need.
Severe hirsutism within short time, development within short time, then we should go for free testosterone level.
Oh, please repeat. This is brilliant. Please come up again. Please, I know it. I heard it clearly.
Hirsutism like sudden and severe degree, then we should go for free testosterone.
With the FG score being going towards 6, sudden fast developing towards 6.
Sudden onset of hirsutism.
Right? I'm sure with such a brilliant answer, you must also be sensitive to the fact that you should also get an adrenal scan done here, because it could be an adrenal tumor developing. First time presenting. Thank you. I don't want to go into rare areas. Manubhai has given me a very clear mission. And our Bagde Sahib rang up and said this: AUB in adolescent, nothing more. And I am on that bullet here. Yes.
Okay.
One more I am telling you here.
If
DHEAS, androstenedione.
If free testosterone is normal, then we need to go for the DHEAS level.
Excellent. Thank you very much, Rajalman. Brilliant. I had expected this answer from you. Brilliant.
If clitoromegaly is there, then should also we go for DHEAS.
Yeah, if clitoromegaly, but these take time. These sometimes take time for the body to respond. This will take time. Clitoromegaly, FSH-LH ratio. Amiben, I want your input. FSH-LH ratio, or maybe Deepali Ben or somebody. I don't know. Yeah, Amiben, FSH-LH ratio.
Of course, there is altered FSH-LH ratio. LH will be high.
More towards LH.
LH will be high.
Okay. You will like to use it for diagnosis of PCOS? No. No. Thank you, Deepak Bhai. You please wait. Deepak Bhai, you wait now. You wait. I have got you. We are coming to something very promising. Gayatri Ben did cover this. She did sensitize us. Something very promising as this girl, before just a couple of years, that video became so brilliant that her expressions, Of course, the younger generation, or probably Deepak Bhai would like to appreciate the girl. People like us would like to appreciate her expression. And what is promising here? And promising here is AMH in the diagnosis of PCOS, a high AMS. Your kind comments, please. Deepak Bhai, your comment first. And if any of the experts are there.
Pankaj Bhai, you have all the signs of PCOS. Why do you really want to go into FSH, LH, and AMH? Okay. Some people say more. Also no need. I wouldn't do it. Just to confirm that her AMH is more than 10. What is the fun? The treatment is not going to change, as you have seen clinically, very clear cut. And only thing I would do is, as Zadal says, is only free testosterone, nothing else. If you really want laboratory investigations, I wouldn't do anything else.
Okay, thank you very much. If anyone else wants to put in a point, Diptiben, you were very expressive. Your body language was expressive. My fingers always remain fiercely on the pulse of my audience, always.
Sir, alone AMH is not indicative because cutoff value for different ages and is not yet proven.
Yes. And as Deepak Bhai said, as a thorough clinician, you already got the data, you got enough evidence. And as you said, it is still not coming in the guidelines because there is a severe overlap of values. It may turn out to be very promising, but as of now, we can wait. Okay, we come to the interventions now about PCOS because we have one or two other situations to cover, and we have covered in 40 minutes. We have got 20 minutes. I will not go for 20 minutes. Your comments on lifestyle changes and their importance. How important lifestyle changes are. Rajal Ben has worked very hard on this. I know she takes lectures on this in Ahmedabad. No wonder she is now bidding for the committee chairman. I know she deserves it well. Yes, Rajal Ben, would you like to give your comment? Lifestyle changes?
Yes, of course. The diet and the exercise is the very prime role for not only for PCOS, but for her future life also. So all adolescents needs to be taught about the smart diet, what is important for her health, and exercise, important of exercise. So this is very, very crucial because these are the growing years. And I always tell in my lectures that just as we keep money in the bank, so that our future is secured. So you invest in your health during these years so that your future is secured.
Juani ma rarelu means mehnat kareli, invest karelu. Ne gadpan ma darelu. Darelu એટલે આ સુરત બાજુનું છે બેન અમારી બાજુનું હું ઓરિજિનલી સુરત બાજુનો છું મારું સાસરું સુરત મારું પાકિસ્તાન સુરત છે that is where the whole thing comes. One parent, I want your comment. Yeah, Girish, you can give me your comment on this. One mother was very smart. She came in and she told me that, sir, I have stopped cooking or telling the cook, we don't let unhealthy means oily foods and all, and we store all the snacks in opaque containers. When you are hungry and you want to see, this is psychology. This is playing on psychology. We store it in opaque container or steel container so that she can't see what is stored inside. And I have changed my timing of the gym. I go with her. Alone to go in the gym. The reason why, honestly, Girish bhai, I am going to the gym for last nearly 25 years is because we have a Hindustan-Pakistan relationship with my wife. We both go together. Okay, if Hindustan goes to sleep, Pakistan wakes up. And if Pakistan goes to sleep, Hindustan wakes up. Chalo. Now, please don't ask me who is Hindustan and who is Pakistan. But can you please tell me about the lifestyle changes, your comment on? Yes, your input. Yes, please, quickly.
Sir, whenever a patient diagnosed case of especially adolescent PCOS came to my clinic, I really emphasize on the lifestyle management because what happens in usual practice, most of the doctors, they are engaged only with the clinical management. I mean, they prescribe the OC pills for 3 months, 4 months, 6 months, but they don't emphasize or they don't, emphasize or the lifestyle management. And even if they are telling to the patient, they are telling in 1 or 2 lines and that's up. And that's what happens. As soon as that girl, she ends up with the OC pills course, again, she gets the same situation. And that's why we should forcefully counsel about the lifestyle management, and not only to the girl but to the family. And unless and until that family takes an active role along with that girl, it is not possible at all. And one most important thing, the continuity in the lifestyle management forever or for many years, that is more important.
It is in your
than
genes and you are born with it. You can't help it. It is in your genes, you are born with it, and you can't help it. Excellent.
Can I add one thing?
So it should be prolonged. It should be prolonged. That lifestyle management. It should not be timing for months.
So, yeah. The only thing is, suppose if you really want to help your girl out, the family has to support fully. The family has to be in it. The family has to change the diet, not the girl only.
Exactly.
Forget the opaque bottles. You don't have those opaque bottles or the crystal clear opals. You stop eating those snacks.
Stop it. Stop it. Don't
you
buy
stop it.
Don't buy
Lead it by example. The only way she can learn is you lead it by example. You have to sacrifice your diet.
Super.
Then probably, yes, you'll do it.
These are the medications which are used. Estrogen progestin preparations, combined COCP with metformin and anti-androgens. Any one of you, your comments on this, COCP, which do you use, and very quickly can you just summarize it? Estrogen progestin preparation as first line of defense. Then we have seen all this. Lifestyle and all is part of it. Okay, now you come to medication. Would you like to give COCP or directly straight metformin without proving insulin resistance and anti-androgens? Any comments?
Sir, unless and until we have any evidence of insulin resistance, metformin should not be given. The combined OC pills are the, should be preferred, and especially the progesterone should be like anti-androgenic progesterone. For the adolescent girls, desogestrel is supposed to be the best progesterone as per ISHRAE 2018 guidelines instead of that cyproterone acetate. So the cycle for 3 to 6 months should be given to the girl. It acts in two ways. Number one, it increases the level of SHBG and it reduces the levels of testosterone, that is androgenic level, and that's why it helps for that girl. And along with this COCP, it also corrects the cycles. Not only it reduces the levels of androgen, but it also corrects the cycles, and that's why the girl and the family, they get the sense of well-being, that she gets the confidence that she is getting treated, and that's why
anti-androgens.
Sir, plain anti-androgens, at least I have not used in my practice till now.
Anyone has used Amiben or somebody?
No.
Raju bhai?
No.
Raju bhai, I want you to stay back. Next situation, I want your comment.
No, Pankaj bhai, I want one clarification here. Would you like to give it only for would you like to give it only for 3 to 6 months, or would you really increase it more than?
May require individualize the case.
I personally feel 3 months is too less. I think
individualize the case.
Yeah, fine.
Individualize the case.
Yes.
Sir, many a times patient with acne and hirsutism, they are with the skin people, and simply they are treating the external appearance and not the root of the disease. So I think that is more important, to minimum 6 to 9 months treatment for acne, and for hirsutism still longer.
Good one.
So we have to treat the root cause.
Very brilliant inputs from both the teachers. Endometriosis in adolescents presents most of the time with dysmenorrhea. Rarely they can have AUBs. Only one slide on this. How do you manage endometriosis in your practice, Raju bhai? In adolescents, you find she has dysmenorrhea, and there are reasons to believe she has still not got chocolate cysts. How do you handle this?
Okay, best is to investigate her for a pelvic endometriosis also and adenomyosis both.
Yes, and
I have seen young girls 14, 15, 16 years with a extensive pelvic endometriosis.
Therefore,
you need an operative procedure for that pelvic endometriosis.
Yes, we do. Do you, after operative procedure, put her on, in case required, suppose there is a chocolate cyst, do laparoscopy, remove it, and then put her for a long time on any of the compounds which Gayatri Ben mentioned, like combined oral contraceptives or any of these, anything? Do you do it in your practice? No.
None of them is very effective in controlling pelvic endometriosis. None of the treatment.
Okay. Now, Deepak bhai.
Okay. Do you mean to say before laparoscopy or after laparoscopy?
After laparoscopy.
arthroscopy, I think I would like to be in amniotic state, and I would really like to do it for at least 3 to 4 cycles.
3 to 4 cycles.
I would do it. I would do it.
Okay, you are doing it fine, sir. Sir, in this, all answers are right. This is like truth. This is like God. All perceptions are right. I'll tell you why. Because you still don't have a complete answer on endometriosis. So you are also not wrong. Raju is also not wrong. And this is where, by and large, your clinical practice, therefore the entire theoretical list is getting filtered into. So you decide what does your practice tell you, and accordingly, even if you add for 3 to 6 cycles, it's fine. If you are not doing something irrational. Thank you very much. It's very uncommon. Adolescents and fibroids are strange bedfellows. They rarely go together. How do in your clinical practice, you handle fibroid in adolescents? An adolescent with fibroid and AUB, or an adolescent with asymptomatic fibroid found by chance? In such a situation, does size and location matter to take a decision in such situations? Just imagine you are in your consulting room, and how will you handle this? Purviben, would you like to give your input? You are sitting in your consulting room, and you get such a case. Purviben, would you like to tell? An adolescent with fibroid and AUB. Purviben is there. You can unmute yourself and please. Is Purviben there? If she is not there, then anyone else can, please. Anyone else, please.
Practically, because fibroid is a structural cause of AUB, practically, according to the palm coin classification, it's very unusual to get an adolescent girl with a fibroid, and especially the symptomatic fibroid. But if at all, if I get such kind of girl in my hospital, definitely the size and the position of that fibroid I will take into consideration. And if it is really needed, and if my patient is not getting cured with the clinical management, then definitely I would like to go with the laparoscopic myomectomy for that girl if it is at all, if it is needed.
Okay, thank you. Thank you so much. Come to the last situation and we'll pack up. Miss SV.
Pankaj bhai, I know I'm overlapping, but I would like really to know the opinion about chocolate cysts and the medical management before we really go to a surgical part. Is there really a role? And if there is a role, up to what size you
would what size? To what size? Unsettled issue?
Okay, people say 4 centimeters you require.
4 centimeters you can wait.
But do you really feel that those medical...
No, because many times, okay, now you are converting me into, because you have that privilege and you are the co-moderator. It will usually not be isolated. Okay, yes. You may see it isolated. Second, there will be seedlings there. So yes, I would like to take a look at it and remove it. And then institute a medical management to couple it, as you have mentioned. And it has benefited me. Unsettled issue, once again I'm telling, I may be proved wrong, I can be proved right. Either way it can go. But this is what we do. If we find a chocolate cyst which is symptomatic, usually presents with, as our first speaker Lata mentioned, usually presents with dysmenorrhea, then yes, I would like to, all the more I would like to intervene.
No, I think I will intervene in all the cases.
Yes.
Really, if it is really proved. Yeah, there's a message I really wanted to pass, and thanks for getting it very clear from the slide.
Thank you very much. Excellent. Last one. Miss SV, a young adolescent girl whose mother has brought her for complaints of repeated nagging episodes of recurrent pelvic pain that exacerbates premenstrually. Clinical examination is non-contributory, per abdominal examination, at the most a per rectal examination. When she is taken up for ultrasound examination per abdomen, she tells you that she is sexually active. But then she told me there that, uncle, I am sexually active. And when I did an ultrasound, I found this in the broad ligament. This was on the left side, and this was on the right side. Huge congestions on both sides.
Broad ligament varicosities.
Yes, sir. How do you handle it? How should we handle it? How do you? I'm sorry, I'm not taking your exam. I told you even previously. How should we handle it?
Most of the people.
Yes, Raju, please go ahead. We are coming to Deepti Ben.
we give progesterone, which decreases the vascularity and decreases the pain in the second half of the period cycle.
Yes, sir. Dipti, any other opinion on this?
Sir, we have to rule out the PID like STDs because she is sexually active and she has discharge. So we have to rule out that. We have to do complete blood count and ESR.
Blood count usually doesn't reflect because the circulation arrangement is such. Now, for those who might not be knowing, here a teacher comes in. The circulation disposition of the female pelvis is such. Therefore, PIDs don't get usually reflected in your count. Anything else on to
Can
rule
we
out?
do, because she gives the history that she is sexually active, we do, can do the PV, and then if there is a tenderness, then we need to treat the PID accordingly, and it's a lower abdominal pain, so that we have to give.
So Rajal Ben and Dipti Ben, am I getting you correctly? We examine her, we find uterine movement tenderness, cervical tenderness. Okay, we have seen this ultrasound picture, fine. We give antibiotics and whatever is to be done, then as regards inflammation is concerned, and then repeat the ultrasound, and if still it remains, congestion still remains, which can remain, irrespective of whether you have treated it or not, because these are hyper or overreaction of the pelvic vessels to the inflammatory process. It can remain. So in such a situation, then put her, as Raju bhai said, on progesterone. Have I got you correctly?
Yes, sir.
Yeah? Okay, thank you very much. So
ideally, we think we have to stop the organ function for a few months.
Yes, correct. Fine, friends, you will agree with me, old and new coexist in adolescent AUB. You have made my fundamentals clear, and I have still got 3 minutes. I'll finish in one. You have been this teacher for us. This is me, and I represent all the students here. This is you, including the experts. And now we are in a position, thanks to you, that because of you, we are able to make our subjects here are patients, so-called patients, fly.
बनूं उड़ती फिरूं मस्त गगन में, आज मैं आजाद हूँ दुनिया के चमन में। पंछी बनूं